There we go. Okay. Hey, welcome back. So we're going to dig right in and talk about dry needling and try to answer any questions that you might have about it. So first of all, if you can just kind of give us the overall theory, what dry needling is and how it works.
Mm-hmm. So first of all, it's not acupuncture. A lot of people tie those two into the same genre, and it's like saying a carpenter. Anybody who uses a hammer is a carpenter. The needle is just a tool that a bunch of different professionals use. Acupuncture just goes very superficially into the tissue, and dry needling goes into the muscle tissue. We hit anatomical spots in the body with that. And so it's been around for 40 plus years. It was developed in the United States, not in China like acupuncture and stuff like that. And it was actually discovered by Kennedy's physicians because he had chronic low back pain. And so physical therapists have been doing dry needling for about a decade now. Previously, just MDs could do it, and now that PTs are getting doctorates, PTs can do it as well.
So who would be a good candidate for dry needling? What kind of situation?
So anybody with tight muscles can benefit from dry needling. We have professional athletes that come in and get it just to improve their recovery time so they can get back to training harder, faster. We have, Colorado is what's called a direct access state, so you don't have to have a prescription to come see a physical therapist. So we have a lot of people that just get injured playing a sport, little soccer players or something like that, and they'll pop in because they strained a calf and need to get it released. So they can, again, get back to playing.
So quickly. Is it a temporary fix, or how long does the effects of releasing a muscle last?
It kind of depends on how long the issue's been going on. We have people that come in with chronic low back pain who have had back pain for 25 years or for as long as they can remember. And those people, it takes quite a bit longer to get stuff to release because they have a lot more tissues involved. There's a lot more compensation that people have learned over a long period of years. If it is a person who just strained a muscle on a playing field or riding their bike over the weekend, then it's usually pretty quick and it's one visit. After it's become a chronic thing, then it can be anywhere from 6 to 12 treatments.
Okay. So it could serve as a pain reliever kind of almost immediately. At least that's what I've seen people that you've done have said, wow, it feels better almost immediately.
Yeah.
But then what's happening physiologically that would, is the idea to release your muscle so that you can regain sort of normal movement in the joint that's around it and
Yeah, so typically what we do is release the tight muscles so that people can start functioning in a biomechanically proper position. And so then we ask them to avoid anything that causes pain after that. So if, they hurt when they bend over and pick stuff up from the floor, we ask them to modify that behavior until they actually have developed the strength and the proper mechanics to do that again. So again, somebody with low back pain that's had back pain for 25 years, their body's relearned how to do stuff improperly. And so what we want them to do is to learn how to do that properly. So changing those patterns can take a long time. It's like a basketball player shooting over and over and over and over again to develop that muscle memory. It's tough to change it once it's been developed. So again, it will depend on how long people have had the issue and how fast they can retrain those motor patterns.
Okay, so if somebody were to come in and see you for this process, then you would do the needling and then also describe and explain different exercises and stretches that they can do to work on that particular area to regain normal movement ranges and just kind of retrain them.
Yeah. So if someone came in for a session, they just don't sit down and get dry needled. We have to figure out what's going on first and do a full evaluation. And so we look at static posture just to see where your body's neutral position is, and then we look at walking or gait to see where your body's choosing to find functional motion from. We check out balance and range of motion and just see if the joints are actually moving properly and in conjunction with one another. And then based on all that information, we figure out where we need to needle to get the pain to go away, if needling is even appropriate for you, which it is for probably 75% of people.
So how long does it take?
The needling?
Needled, yeah.
Just for the needling, probably about 10 minutes.
Okay, and then what is it? Is it really painful? Are people who are afraid of needles going to have a problem with it? What's it like?
No, there's people who have had a very prolific fear of needles, and they'll let me put one in their arm or forearm in the area that's not injured typically, and they're like, oh, that's it. It's not a big deal at all. They're very, very sharp monofilament needles. I'll show you one here. So skinny, sharp needles. And so because they're so sharp, they're single-use sterile needles. Because they're so sharp, you actually don't feel when the needle goes in through your tissue because it's a very fast insertion process. And so you do feel when we hit a trigger point. It just feels like a funny little contraction of a muscle in there, though, and which is what we want. We want a twitch response when we go in there. So it kind of feels like an eye spasm or an ache a little bit. The needle's only in for about 5 seconds. It's very quick. It's not like a cortisone injection. It's not like a vaccination. It's nothing like that. Those are very big needles compared to these. And so if you don't hit a trigger point, you don't feel anything but pressure at all. People don't even know that there's a needle in them.
And is there any risks at all? Are there any risks?
Just like with any needling issue, there are some risks, but the risks are bruising. Maybe 1 in every 15 needles will bruise. Soreness, and it just feels like workout soreness because the chemical that's released from the muscle that's holding the muscle tight in the first place is one that causes a contraction when you go and work out at the gym. So it just feels like you worked out afterwards. And that lasts for different time periods on different people. If you're fairly active, it can last for an hour. If you're not active at all and your body doesn't really know what to do with that chemical, then you could be sore for a few days. That end of it is pretty rare, though. And then as far as the other risks, there's risk for infection because we're sticking you with a needle. We've never had one. We wear gloves when we do the procedure, and we clean you off with alcohol so we're not pushing any superficial bacteria down into your tissue. You do have to be cancer-free and infection-free to do it. And that's just because with needling, it will draw your immune system to that area. And so if you have a sinus infection, for instance, you won't fight that infection at 100% because part of your immune system is going to be down where we needled as well.
Okay. Boy, so bottom line, it sounds like
it's very safe.
Yeah, very safe.
Very safe, very effective.
Yeah, very effective, right.
It's growing exponentially in the U.S. because it is so effective.
Awesome.
Yeah.
Okay, well, thanks for the information. We really appreciate it.
Thank you.
Thank you.